Hello and welcome to the Excel Nursing Academy. So students, today we are going to discuss a very important topic. As we know that our Norcet 7.0 is very near. We just have 3 days for that. So 3 mistakes that we need to avoid in Norcet 7.0 in order to crack this year exam. What all 3 mistakes that you need to avoid completely, that we are going to discuss in today's video. Our first mistake that we need to avoid, the very important, is to completely avoid cramming just before the exams. You only have 3 days left and then you're trying to memorize a large amount of information the night before the exam. What this will do to you? This will lead to confusion, forgetfulness, lack of concentrations, even lack of doing correctly, answering correctly, even in the points that you are confident about. So avoid all of that. You will think that, oh, I have not studied pharmacology, 50 new drugs. Let me read those drugs before the exams. Avoid doing all of that. A better approach to avoid cramming is to review the key concepts and practice solving problems throughout the week leading up to the exams. What it means is, when you were making notes, you had to, I think most of you will have underlined the important key points, the important key concept. For example, if you are studying the stroke, then you would have highlighted the window period, the drugs that are used in stroke. And now is the time to review all the key concept, not the whole concept. You will not start reading one by one all topics completely, fully. No, you have to review the key concept. You have to revise the key concepts, keeping in mind the time that you have. And then practice the problems. Just review the key concepts and then start and solve the problem. Few of the problems that you have solved. This is how you avoid cramming a lot of the content, a lot of the syllabus that you have. Then coming to second mistake that we need to avoid is reading the questions hastily. Avoid reading questions very fastly, because I know you have a less period of time. You have a ticking time clock right above your head and a lot of questions that you need to solve. But what you need to do is, because the questions in Norcet are tricky, they have a very important keywords like not, except. You will read a question that which of the following is not a sign of hypoglycemia. If you read this question very hastily, you will tend to miss the keyword not, and you will pick the answer which of the following is a sign of hypoglycemia. But if you read this slowly, emphasizing the key points, that is not, then you will correctly answer this tricky question. So highlight the important keywords when you read them. Slowly read all the tricky questions that are in the Norcet exams. Our third mistake that we need to avoid is blind guessing. Third and the last mistake is to completely avoid blind guess. If you do not know any of the 4 answers of the MCQ, if you read a question and you read the MCQ answers and you have no idea what are the 4 options, then you need not guess the answer, because we know there is a negative marking, we know there will be a merit, and in that merit you can use a lot of ranking due to those few guesses. So you are unsure about a question on the medication side effect and you guess blindly instead of eliminating the obviously wrong answers. So what you need to do is, if you have idea about the options, then only you can do the guesswork. And even if you want to do the guesswork, then use the elimination technique. For example, we have a question on a screen that a patient with a history of COPD is admitted to the hospital with acute exacerbation. Which of the following intervention is most likely to improve oxygenation? Our first option is A, administering a bronchodilator, B, restricting the fluids, C, placing the patient in a supine position, D, administering a diuretic. So now if you do not know the answer, we'll start by eliminating. In the elimination technique, you eliminate all the obvious wrong answer one by one, and that's how you get the answer. If you do not know the answer in these 4 options, then you'll eliminate what is the most wrong that you think. The most wrong, as we know, is the C, which is obviously wrong, that placing the patient in a supine position. If a patient is having a breathing difficulty, then supine position will also aggravate his breathing problems. So we eliminate the C option completely. So we have removed the C. Then administering a diuretic. This is also irrelevant, that your patient is having breathing problem and you are administering a diuretic. Then we have 2 options left, A and B. B, if you see restricting fluids. Restricting fluids, as we also know, that it is out of irrelevancy that the examiner has put, because COPD generally in the exacerbations we do not restrict the fluids. and instead in the asthmatic conditions, all of the respiratory conditions, to loosen the mucus, we ask the patient to drink more fluids unless it is a indicative of edema and all of those things. So restrictive fluid also become irrelevant and cancelled out. So now the only option left is administering a bronchodilator. So by this way, eliminating one by one the wrong answer that you know, we have gotten our answer. That is how you solve using the elimination technique and avoiding completely blind guessing. Never answer a question when you do not know any of the 4 options. So we have today discussed our 3 main mistakes. As we know that Norcet is in 3 days, so 3 mistakes that you need to avoid in the Norcet 7.0 after 3 days is: A. Avoid cramming. B. Avoid reading the questions very hastily. And 3. Avoid blind guessing completely. I hope you will keep these points in mind when you will be attempting the Norcet 7.0. And additional mistakes that you need to avoid, that you need to keep in your mind while attempting, is changing your study routine or the resource in the last few days. Do not try to think that, okay, I'll change my book in these 3 days. Do not do that. I'll change my study routine. Stick to what you know, stick to what you are strong at, and just see what you do in the exams. Then avoid second guessing yourself. Do not think, I do not know this, oh my god, how I'll do in the exams. You know it. You have this in your mind. You have this as a goal and you will achieve this. Keep that confidence within you. Avoid thinking that, oh my god, what if I do not clear this exam? Do not think that. Do not second guess yourself. Do it with all the hard work. Think about that you have learned. Think about the hard work that you have put into, and just wait for the result. Avoid discussing your exam with your stressed friends. Do not take all the stress, all the anxiety from other people around you. Just focus on your goal and keep studying, keep working hard. And I'm completely sure most of you will crack the exam if you follow these points that I told you, if you avoid these mistakes. And all the best for everyone who is attempting the exams after 3 days. I will keep me updated about your results. I'll be waiting. And keep in mind all the mistakes. We'll meet in the next video. Till then, like, share, subscribe and hit the bell icon so that you will never miss a video that we put. Thank you.